Good morning, everybody, and welcome to this RCPCH webinar on upskilling primary care colleagues for Diploma in Child Health Pathway. Today, we'll be presented by Venu and Geethika. The presentation will last for approximately 35 minutes, following which we'll take questions. You can submit questions at any time during the presentation through the Questions tab on your screen, and we'll hold most of the questions through until the end of the presentation. We'll also record the webinar, so if you have any colleagues who are unable to access it today, they'll be able to access the recorded version on our Compass website in a few days' time. So without further ado, I'd like to welcome Venu and ask him to start the presentation.
Thank you, Sarah. Welcome to you all. I'm Venu, the chair of the DCH clinical exam. And on this panel, I've joined besides Sarah by Geethika, who is a chair of DCH Scenario Generation Group. This webinar highlights essential skills in primary care consultation with children, showcasing extracts from the college DCH clinical exam preparation course. We are also discussing the advantages of attending the exam preparatory course run by the college. By the end of the webinar, we hope you would be familiar with the format of the DCH clinical exam. We'll also get exposed to the DCH clinical exam scenarios, understand the value of DCH clinical exam preparation course. You will also be able to reflect on the essential components of an effective consultation with children and their carers in the primary care setting. I'll now pass on to Geethika to discuss in brief the format of the DCH clinical exam. Geethika, please.
Hi everybody, I'm Geethika. So the key objectives of the clinical examination of the DCH is to assess whether the candidates have reached the standard in clinical skills expected from a newly qualified general practitioner in UK who has a special interest in pediatrics. Most of the question scenarios are generated in reference the candidate being a GP. So the DCH exam is mainly for general practitioners, but it's an important step in career progression for A&E doctors, anesthetists, ENT doctors, pediatric trainees in rotation. And in a nutshell, it's an exam for any clinician involved in treating children. This slide will give you an overview of the exam. It has two main components. The first component is talking stations, which last for 6 minutes. You will have some time in preparation outside the room, and you are awarded a 1 score. This consists of 2 communication stations, a structured oral station, and a station on data interpretation. The clinical component of the exam, which is a second component, has 9 minutes. You are awarded 2 marks or 2 scores. The initial 6 minutes of the station is an action or your performance, and the next 3 minutes will be a discussion with the examiner. It consists of safe prescribing, clinical assessment, a development assessment, and history and management planning. This summarizes the station I mentioned to you earlier. The initial 4 stations are the clinical component of the exam, which has 9 minutes, which has history taking, clinical assessment, which can involve any system examination. It can be cardiac, abdominal, or respiratory, a development assessment, and safe prescribing. The talking stations consist of structured oral, data interpretation, and the 2 communication stations. You can now see how the scenarios are run in the exam day. So the talking stations will have 6 minutes, as I mentioned. It has a communication station 1 and 2, and then you'll have data interpretation and structured oral. Each of these stations, you have a couple of minutes outside the room for preparation. You have 3 minutes in between each station. This slide illustrates the clinical component of the exam. So it has clinical assessment, as I mentioned, which will assess any of the systems, and it has safe prescribing, child development, history taking, and management planning. These stations are for 9 minutes, of which the first 6 minutes you'll have action to perform. Then the latter 3 minutes you have a discussion with the examiner. So the examiner will mark you on the performance of the first 6 minutes. You are awarded a 1 score, and the latter discussion will give you another score, which is a combination of 2 scores. There are some important relevant documents which pertaining to this exam, and the links are given to you for your reference. These will include the clinical candidate guide notes, the syllabus of the DCH exam, anchor statements, and a copy of the mark sheets, which will allow you to see how you have been assessed, and some sample scenarios which you can use as role playing with colleagues, and also a clinical examination technique which can be used for both MRCP-CH and DCH. I advise you to refer these documents, which will be a valuable thing before preparation for the exam. Sarah, I can see that there are some questions coming through. Would you mind reading this out one by one so that Venu can provide answers?
Thank you. So the first one is, what are the entry requirements for the DCH clinical examination?
The DCH exam can be taken by any doctor who has an interest in pediatrics. We, however, recommend a period of 4 to 6 months training in pediatrics to maximize success at the exam. The written component, which is the Foundation of Practice paper, FOP, is another component of the DCH, and this can be taken before or after the DCH clinical exam as per your choice.
Thank you. Is there any advantage in passing the DCH clinical examination? For example, will I receive a pay rise after passing it?
Hi Sarah, this is an interesting question. DCH, no doubt, is an added qualification and will enhance your confidence in the diagnosis and management of common childhood illnesses. Definitely, the patients and parents, and in due course your colleagues, will recognize your competence. Regarding the pay rise, unfortunately, the answer is no. But let us hope the enhanced competence will attract more children and young patients to you and will ultimately be translated into increased activity and pay.
And finally, do I have to complete the FOP theory paper prior to the clinical exam?
No, you can pass the theory component up to 7 years before to up to 7 years after completing the clinical exam. However, both components must be completed to be awarded the DCH qualification. Geetika, can we now proceed with the details of the course proper?
The key aims and objectives of the course are is illustrated here. So after attending, the participants will be able to be fully aware of the exam format, and they will also know what you are expected in different stations. You will also get a clear understanding of the assessment criteria for each and every station. You will also have an idea about the requirements to pass each and every station. The experienced faculty members who run the course will give you enough information about the common errors the candidates make and how to avoid them. It will be an added benefit. You will be able to reflect on the content, knowledge base, and preparation needed to ensure exam success. This is the overview or the agenda of our next course, which is on the 19th of October 2018 in the college. We start the registration around 8:30, and after welcome around 9 o'clock, you'll be divided into small groups. In the morning session, our main concentration is on the talking stations. You'll be practicing this in small groups with the faculty members, and you'll be practicing communication, history and management, data during this period. You will have a break in between, and around 12:35 you will have lunch. Following the lunch break, the more emphasis is on the clinical stations. You'll be exposed to clinical assessment, child development, and safe prescribing in small groups. Once the course is over, the panel will be discussing any questions you have, and you'll have a feedback. Now, Venu will go through the DCH clinical examination preparation course in more detail, and you will also able to see some of the video clips which we have recorded during one of our previous courses.
Thank you, Geetika. Let us look at the course in a bit more detail. Our course faculty includes experienced DCH examiners as well as GP trainers and question setting group members. It's important to note that the scenarios that we discuss are questions that have been taken out of the question bank and hence represent a true picture of what the candidates will face in the DCH clinical exam. The course further highlights tips to enhance performance of the candidates at the exam. Candidates generally find two stations more challenging: the child development station and the safe prescribing station. This course will allow enough preparation for these two stations as well as for all other components of the exam. Here you see one of our colleagues' faculty addressing on the top tips for the developmental assessment station. The faculty then demonstrate these top tips to help with the child development assessment. The candidates have ample opportunities to participate in simulated development assessment, followed by feedback and suggestions. Please view this constructive feedback from the faculty to one of the participants at the child development assessment station.
Try to establish whether she can use two words before going on to the complex sentence. So you did it in progression order, which is very good. But remember, you did very well. But remember, you have to bring in different objects to use and test language.
Books is very good.
Books is very good.
Books, yeah, it's quite. I didn't even think of books. It's quite difficult to prompt language with objects.
Safe prescribing station is another one which is often a challenge to candidates. We play we give special emphasis to demonstrating the top tips on how to fill an FP10 form and also how to organize your thoughts related to discussion on this important station. The participants then receive actual scenarios from the question bank, and they have the opportunity to practice, which simulates the real exam setting. They will receive the feedback from the faculty on their performance and any improvements needed. Please do watch this video clip recorded at a recent course related to the organization of this station.
Scenario, and the 2 minutes will start in a minute when you have in a second when you have this. And then I'll tell you when you can go into the station at the BNFs. So let's show you.
History taking and management planning is one of the other stations we discuss at the course. The participants are given the opportunity to practice with a role player, and then they receive feedback from the faculty. Please watch this clip recorded from a recent course.
Hi Claire.
Hi.
My name is Emma. I'm one of the GPs working here today. How can I help you today?
I've just been having really horrible headaches.
Okay.
For a while now.
Okay, tell me a little bit more about these headaches.
It's been going on about 3 months, and yeah, they're really starting to become a problem.
Okay. And when you say it has started to become a problem, what sort of problem are you thinking
Well, I'm just
of?
having to take loads of time off school, and
Oh, no,
I can't
okay.
really afford to be doing that.
Sure. So how many times have you taken off in the last few months?
Well, in the last little while, I just got told I've taken 15 days off.
Oh, wow, okay. So quite a bit at the
Yeah.
moment, isn't it? Tell me a bit more about your headaches. So how did they start?
I don't really know. I mean, they just started, about January,
Okay.
and they're every week.
Mm-hmm.
Sometimes they're so bad I have to go to bed.
Oh, wow, okay. And what time of the day do you generally get these headaches?
You'll get a little piece of paper that will have an initial blurb. It will give you something very brief, like Johnny is an 8-year-old boy who has central abdominal pain. So you know vaguely what the sort of headline condition is. I would say this is a good point to calm down and get your head sort of into, right, what sort of things might I be looking for when this comes up? The most important thing really is to look at, if in this abdo pain or in this headache or in whatever, what are the red flag things that I cannot miss in that history? And make sure you have that. You can jot them down on a piece of paper or whatever you want to remind you, but make sure you have those so that when you take in the history and you start getting immersed in the social side of things, that you haven't missed any of your red flags, just in case that it is there in the history. You get 6 minutes. There used to be a warning knock at 5, but people now get muddled by all the knocks on the doors, so they don't do that anymore.
The DCH clinical exam has 2 stations on communication assessment, emphasizing the importance of communication in our day-to-day practice. In our course also, we give special emphasis to communication stations. The participants are able to practice previous exam questions with a role player and receive feedback from the faculty. Please do watch this clip related to communication stations.
But I think it's quite useful to look back and see how you felt it went, because we can all learn from that together. So Bryson, how did you feel that was?
When I read the topic, one thing that came into my mind.
And Mum, how did you find that?
I think you did actually give me the time though to express myself, which I thought was really effective, because then you had a much better idea of where I was starting from. That actually I haven't really absorbed much at all. I guess the only thing I'd say is
what it is that he's got, and then how do you know he's not epileptic, and then perhaps I don't know the figures off the top of my head, but she's saying, well, what are the chances that it happens again? We can actually give a figure or a percentage and say, well, this proportion of patients go on to have another one, but generally most don't, and they grow out of it. But just to reassure her a bit more.
So you might like to review, just read up about the common stuff a little bit more to have that information to give, because often common things come up quite commonly in exams.
Coming to data interpretation, this is a specific station for DCH clinical exam. The candidates have the opportunity to practice again on previous exam questions in small groups. The proposed questions and suggested answers to score a clear pass are then discussed by the course faculty. These discussions do help you to score a clear pass in these stations, which is important in the overall pass. Sarah, let us look at some more of the questions that we have received. Geetika, would you mind answering these questions while Sarah reads these out? Sarah, please.
So you mentioned that there are no patients used in the preparation course. Is it still worth attending?
Yeah, this is an important question, and actually, in fact, we were trying to discuss it on the next slide. So since all the courses run by the college does not involve any patients due to legal issues and practical difficulties, this course does not have any patients either. But the experienced faculty members will simulate real exam scenarios without patients. All the participants will have enough guidance and opportunities to practice like the real exam cases. I also would like to highlight that in the DCH clinical exam, only 3 stations have patients.
Thank you. Are there any recommended books that I can refer to in preparation for the exam?
There are several books on the market that will help you in exam preparations, but we recommend the one published by the college. You can see the cover page on this slide, which is Clinical Cases in Pediatrics, DCH Clinical Examination. All the candidates who will register for the DCH Clinical Exam Preparatory course will get a free copy of this book, which is an added benefit. We recommend to refer this book in preparation for the exam.
Thank you. And the next question is, joining the webinar late, are there any real advantages in attending this course, as I prefer my own preparation for exams?
When you attend the course, you'll have the opportunity to expose to true exam scenarios and receive valuable feedback from our experienced faculty members. This is an excellent opportunity for all the participants prior to their preparation for the exam. As I mentioned, you will receive the recommended book published by the college when you register for this course.
Thank you, Geetika. We do receive good feedbacks from delegates. One of them you can see on the slide here, very clear about what the DCH exam expects from an examinee. A good faculty, knowledgeable, approachable, friendly. I would also like you to view this delegate feedback, which was recorded at the last session.
This one's nice. Lovely for us to hear which bits of the course you found lovely.
I just want to say thank you all because this course was really helpful. Specifically, what really helped was to get a clear understanding of what's expected of us in each of the stations and the things that we can avoid. I can't find any criticism. You're all obviously very experienced, and it's made me very confident, a lot more confident now about facing the exam, and I think that's probably a large part of what's required to pass, because it's getting over the fear of the unknown and what's expected from you. So thank you very much.
Thank you very much. So we've now reached the end of the presentation and it's open to questions from attendees on the webinar. As mentioned at the start, if you'd like to submit questions to us, please do so through the questions tab on your screen.
Sarah, are there more questions? Could you please read out for me?
Yes, we have two questions which have come through. The first question is, do we have the DCH clinical examination conducted outside of the UK?
Thank you for that question. We were hoping someone will ask that. Indeed, the DCH clinical exam is also run in other countries outside the UK. We have the exam in Egypt running twice a year, in India once a year. We have the exam in Hong Kong, which is once a year. These overseas centers, we make sure the exam scenarios and questions are modified appropriately to suit the local requirements and the training of the candidates. However, we suggest that the candidates who take the exam from overseas do attend a training session, and they do have a slightly longer session in pediatrics training before they attempt the exam. We would be happy to answer any more queries on that. Thank you, Sarah.
And we have another question through. Is it necessary to undergo training under a doctor affiliated with the Royal College of Paediatrics and Child Health for the DCH exam?
That's also an important question. The answer is no, actually, because all pediatricians would be, they are trainers, would be able to help you to approach the exam and perform at the exam. The advantage of liaising with an RCPCH examiner or any doctor who has the qualification, either a membership or a diploma in child health awarded by the college, is that they would be able to help you with from their personal experience as well as from knowledge on the exam scenario, what is expected of the examiners. So it would be helpful to have a chat with the RCPCH examiners or doctors in your area who have already gone to the exam, but it is not a must. Any good pediatrician should be able to pass a DCH clinical examination. It is so simple and straightforward and takes into account all that we do in our day-to-day practice, starting from examining a child, taking a history, doing a prescription, doing investigations, communicating with them, and overall being a good doctor for the care of children.
Thanks, Manu. Just to say a final thank you very much for those of you that have taken the time to join us today. We hope you found the webinar interesting and informative. It has been recorded, so it will be available on our learning management system, the Compass website, and you can see the link at the bottom of this screen for how to access it, as well as many other RCPCH webinars that we've already recorded, as well as ones that are coming up. Those of you that have listened today would be really grateful if you could use the first link on the screen to provide your feedback on this webinar so that we can use it to improve the service further. But thanks once again. We hope you found it useful and enjoy the rest of your afternoon. Thank you.